everyone, welcome back to my channel, Nurse B86. Today I am going to be continuing on from the last video on the treatment options of hemodialysis. So I'll be elaborating further on hemodialysis again today. So let me get started. So to start hemodialysis or HB, you need two tubes to be connected to you from the machine via the AVG or the arteriovenous graft, the AVF or the arteriovenous fistula, or your dialysis line or the CVC. With the AVF or the AVG connections, two needles are inserted into the fistula that's typically in your arm. And then it is taped at the entry point. The top needle is usually connected to a red line which draws blood out, and the bottom needle is connected to a blue line which brings the blood that has been circulating out of the machine and cleaned back into your arm. With the dialysis line or the CVC, two lines, again, two plastic tubes are connected to the line that's in your neck, chest area or your groin. So we have the same red and blue lines, and the line in you usually has a red tip and a blue tip. So the red line goes directly to the red tip and the blue line goes directly to the blue tip. These tips are known as ports. So like I said, the red line pulls blood out from your body and goes through the dialysis machine to be filtered and cleaned, and then it then goes through the blue line, which then brings that clean blood back into you. The dialysis machine is then programmed for a set amount of time. A minimum can be, if you have chronic kidney disease and this is a normal dialysis session, the minimum is typically maybe 2 to 3 hours, and the maximum can be between 4 to 5 hours. How much is removed can be from 500 mils and below for the minimum, and for the maximum we can take out 1 liter per hour. So if you have a 4-hour session, we can only take 4 liters off. A 5-hour session, 5 liters off. We're not really allowed to take more than 1 liter off per hour. Taking off too much fluid can leave you dry, and that's not what we are trying to do. The HD or the hemodialysis mode takes out the excess waste from the blood. Hemofiltration or the HF takes out the excess waste as well as the fluid. And the ultrafiltration mode or the UF takes out fluid only from the blood. The amount to be removed is calculated by using your current weight to your ideal weight. The ideal weight is usually prescribed by the consultant or the attendant. So let's say that your ideal weight, which is the weight that your physician would like you to be at, so with your ideal weight being 88 kilos or about 187 pounds, and your current weight being 88 kilos or about 194 pounds, you will deduct those two numbers. So your current weight, what it is right now, and take away your ideal weight where it should be. So we're going to be doing 88 minus 85. So we have a difference of 3 kilos or a difference of about 7 pounds. So on the machine, that is the amount of fluid we'll be taking off. So 3 kilos will equate to 3 liters of fluid. When patients arrive for the dialysis sessions, they are always weighed before they are connected to the dialysis machine. This is so we can do the calculation as previously mentioned. The rule of thumb is 1 liter per hour. So 3 liters will equate to 3 hours. So then you'll be on the dialysis machine for 3 hours and we'll be taking off 3 liters of fluid within that session. With that said, some patients do come in needing very little taking off, but their time is never reduced due to that fact, mainly because they still have built up toxins that still needs to be removed over that period of time. So their time is not reduced for this reason. So because we take out more than just fluid, each patient gets their full session. So once the dialysis session is over, if you were connected through a fistula, then those tubes are then, then those needles are then disconnected and they are taped up. Because there's 2 needles, obviously you have 2 holes in the arm. and then you put a gauze on each hole and tape them over to put pressure on them so that they can stop bleeding out. However, if you are connected to the machine via a dialysis line or a CVC, then those two tubes are disconnected and clamped off, and the lines get flushed with saline typically. Some may lock it with a heparin or a heparin alternative lock to prevent it from clogging up and getting blocked. They are cleaned before they get capped off, and then that is it. You might be wondering how this process actually feels, and you might be surprised to hear that it's actually not painful. Although it may seem like it is. It is, however, uncomfortable to begin with because obviously it's new, but after a few sessions you do get used to that feeling. In the UK, dialysis is nurse-led, in that we, the nurses, are the ones who determine the dialysis treatments for each of our patients. In the US, however, it's the opposite. Doctors determine the appropriate treatment for the patients. Typically, patients get dialysis sessions 3 times a week and between 3 to 4 hours per session. So depending on the unit you're at and what schedule they got you on, you could be doing Monday, Wednesday, Friday, or Tuesday, Thursday, Saturdays. Each session lasting up to 4 hours, and you could be on a morning, an afternoon, or an evening schedule. There may be an overnight. I know in the UK, the hospital that I worked, we had an overnight dialysis schedule. I'm not sure if that is available here in the US. So this brings me to the end of this video. I will be continuing some more on hemodialysis in the next video, and I'll be looking forward to seeing you all on that one. So until then, keep your kidneys happy and healthy, and I will see you all next time. Have a brilliant day, everyone. Bye.